I'm going to show you exactly how to apply an eye shield on yourself or someone else if you're helping a family member who just had eye surgery, or maybe you're a medical professional seeing an eye trauma. And the best part is, this is hard to mess up. So if you didn't receive instructions or you've never done this before, you're in the right place. The purpose of the eye shield is to protect the eye and the surrounding structures like the eyelids. The goal is to place it over the eye comfortably and in a way where it's not putting any pressure on the eye itself. Eye shields are often egg-shaped, and some of them come with a point. And the question that I often get is, does the point go up or does it go down? Does it go left? Does it go right? We do an electric slide, like what are we doing here? The point goes up. Think, follow the North Star. The point goes up. And to help with comfort, we're going to adjust the positioning a little bit, the angle to be oblique. So if I'm going to be covering my left eye, the point here is going to be right near the innermost part of my brow. So this portion here, let me not mess up my brow too much. As far as the exact angle, oblique angle, again, we don't need this to be perfect, but if I rotate it this way, it doesn't feel as natural as when I just keep rotating, and now it seems to sit a lot better. So you can do a little bit of rotation here to see where it fits more comfortably. And this round part, think of it as the base. So this rests on the cheekbone. So right and left. The concave part of the eye shield is going to be what's facing the eyes. Let's talk about how to put an eye shield on yourself. If you've had eye surgery like cataract surgery, we want to place the tape in a way that the eye shield stays on, which is especially important at night where we can be moving, acting out our dreams. Somebody else can be acting out their dream. It's also helpful to keep the center part of the shield open so that way it doesn't blur or block your line of sight. Because if you place tape straight down right in the line of sight, that's going to blur the patient's vision or your vision. That can affect your depth perception. We definitely don't want any falls or any issues. And here's a tip. Before you apply the tape, brush your hair out of the way so your hair doesn't get trapped in the tape. It can be uncomfortable when you're removing the tape. And for the type of tape, in case you weren't given any, you could use clear tape. This is transport tape. You could also use paper tape, or go to a local pharmacy and ask the pharmacist what medical tape that they would recommend for placing on the face. All right, so let's go through 2 ways to apply tape. So take your tape, tear off about 1.5 to 2 inches. Again, it doesn't have to be perfect. If you want to get a ruler, go ahead, do your thing. All right, piece number 2. Point goes up, follow the North Star. I'm going to rotate the shield away from me and then place tape on the top part, the point, and then at the base. You want to get enough of the shield so it's nice and secure, has a good grip on it. You don't want it to be where it's barely holding on to the shield, because then it's not going to be secure. It can easily fall off. And then the point is up. We're going to rotate it to be oblique so the point is kissing the inner aspect of the eyebrow. And I'm going to kind of rotate a little bit to make sure it feels pretty good. For the second way, you're going to be placing tape like a railroad. And this can be especially helpful at night when you're sleeping. So the tape is going to be a little bit longer. Then you're going to tear the tape in half. So I just kind of place the tape here so it frees up my hands. Now I got the shield. So I'm going to go ahead and rotate so it's away from me. And I'm going to place the tape like railroad tracks. So this way I can keep the center open. Point goes up, oblique. Make sure it feels overall pretty good. It's not going to feel like a spa, but it feels good enough. Just be mindful of where the tape is going over the eyebrow, because if you put a lot of tape over the eyebrow, you may accidentally give yourself a free eyebrow wax. That's where using method 1 can be helpful, because it uses minimal tape. It's going to be trial and error to see what works best for you. Let's talk about how to put an eye shield on someone else. So moving forward, the someone else I'm going to refer to as a patient. For starters, how do you even position yourself? It can be helpful to have the patient in a chair or a bed where you can adjust the height. When I'm on call, there's an eye trauma and I need to place a eye shield on, I'll raise the hospital bed, I'll stay standing, and then I'll just, lean over a little bit. This helps to minimize any back strain for me. But of course, if you're at home helping a family member or friend, you may not have that. That's not a problem. What you can do instead is to have both of you guys sitting, so that way you guys are at eye level and you're just working, arm's length apart. Another way is you can have the patient laying down. Let's say it's in the bed and you can sit at the edge of the bed. In that case, you'll be leaning forward, but luckily putting an eye shield on is usually a pretty quick thing to do. So we've talked about how to position the eye shield. Now let's talk about how to place the tape. It's also helpful to keep the center part of the shield open so that way it doesn't blur or block your line of sight. Because if you place tape straight down right in the line of sight, that's going to blur the patient's vision. And then you're dependent on a better seeing eye that can affect depth perception. We definitely don't want any falls or any issues. Before placing the tape, ask the patient to move their hair out of the way so the hair doesn't get trapped in the tape. That can be a bit uncomfortable when removing the tape. When applying the shield, you could either have the patient help you by you position it and then have the patient place a pointer finger right in the center. This way it'll remind you to not place tape directly in their line of sight, and then it'll also hold the shield up for you. Or you could place the tape on this shield and then place it onto the patient. Let's go through 2 ways to apply tape. So I have clear transport medical tape. You can also use paper tape. Tear off 2 pieces of tape that are about 1.5 to 2 inches long. I'm gonna rotate the shield away from me. I'm gonna place tape at the point, then also at the bottom. Now you want to have enough of the tape on the shield so it's nice and secure, has a good grip. And then also this helps to keep the center open. Point goes up, rotate it oblique, and then have the point kiss the medial aspect of the eyebrow and go ahead and place it on. The second way is going to use a little bit more tape, and it's going to place the tape like railroad tracks. Tear off a longer strip of tape, about 6 inches or so. You can make it longer or shorter depending on the patient's anatomy. Tear it in half. Basically, you want to have enough tape at the top and enough at the bottom. So if you need to adjust it, no worries. So what I'll go ahead and do is I'm going to adjust this a little bit. We're keeping the center nice and open. Patient brushes their hair back and then go ahead and place it on. Let's go through some tips and some other helpful information. When applying the tape and especially wearing it for many days, the skin can get a bit sticky. So what you can do is get an alcohol pad and then wherever it's sticky to basically just clean the area. Now what I would recommend, because you're working by the eye, is to close the eye, and then where it's sticky, just go ahead and just wipe away. Another tip, ask the surgery center or your surgeon's office for extra tape and eye shields. They may not give you extra if you don't ask for it. Now, sometimes people's skin will react to the tape, leading to irritation or an allergic reaction. And this could lead to redness, irritation, skin breakdown, itchiness, rash, bumps, swelling, oozing. If it's mild, there's no pain, and there's no concerns for an infection, take a couple pictures for your own records, but then also to show your surgeon, and then stop using that tape. We want to remove that irritant and switch to a different type of medical tape. So if you were using clear tape, switch to paper tape and look for tape that's hypoallergenic and that says sensitive skin on the box. And these can generally be found at a local pharmacy. And if you're not sure or have any questions, ask the pharmacist. It's also important to call the surgeon's office as soon as possible to let them know what's going on, give them an FYI, because the surgeon may want to take a look at the area. Now, if the skin irritation is worsening, stop the tape and call your surgeon's office as soon as possible to be seen. If you're allergic to latex, if you've had any issues, reactions to adhesives, to tape, let your surgical team know, let your surgeon know. And anytime you're given tape, just make sure, does this have latex in it? Be an advocate for yourself. Good to double check. If you've used an eye shield before, let me know down below in the comment section. How did it go? What worked, what didn't work? And if you know somebody who just had eye surgery or they're about to have eye surgery, share this video with them so this is one less thing to stress about. Click subscribe, and I'll see you in the next one.